A portion of today's show is brought to you by Molina Healthcare of Texas. Well, there are still so many questions when it comes to Obamacare and healthcare. If you are one of those people who are maybe not covered by your employer, but you make too much money to be covered by Medicaid, then you're kind of in a quandary, and I actually fit in that group too. So we have with us Dr. Lori Greenberg with Molina Healthcare, and she's going to share some facts and figures with us and kind of take us through this very complicated mission of finding insurance when you fall in that sector.
Sure. So as you said, the Texas health insurance marketplace is part of Obamacare, and it is designed for people who fall in that gap between where they don't have access to a health insurance plan through their employer, but they make too much money to be covered under Medicaid or CHIP.
So like self-employed people?
Exactly.
Okay.
Right. So it's basically an affordable health insurance coverage option for people in that group.
Now, is it more affordable because your deductible is so high? Because I know when I was shopping for insurance, I didn't want to pay a ton every month, but in order to get that low payment, my deductible was crazy, like, $4,000.
Right. So there's a variety of different plans that are offered. Molina offers plans here in Dallas and Collin County and in other counties throughout the state of Texas. And it really depends upon which plan you select. Of course, the higher your benefits, the higher your cost. But if you look at what are your out-of-pocket costs, what can you afford, and then look at what benefits are most important to you, then there's a lot of different choices, and most people can find a plan that meets their needs and also their budget.
I've heard a lot about like catastrophic policies that basically just cover you in case you become extremely ill. It doesn't cost very much every month. The monthly cost is low, but the deductible is very high, right? Right.
So, I mean, that I think speaks to the reason why everybody needs to be covered, because you never know when you're going to need health insurance, and we're all just, an accident or an injury away from needing it. But more importantly, health insurance coverage provides you with the access to preventive care. So things like mammograms and immunizations, things that will, if you use those benefits, will potentially prevent you from developing diseases. So it's really important for everyone to have health insurance coverage.
And you'd mentioned before that health savings accounts are not really they're not really an option with this. Is there a way that I can, because I have such a hard time like writing the check every month for health insurance of, $300, $500, $700. I mean, I know people who are paying even more than that. When I'm healthy and I really never get sick. And right. My only fear is that, oh my gosh, if I get cancer, if I get something if I'm in an accident, what's the answer for me? What do I do?
Well, I think you have to think about, again, that the things that are preventive in nature. So, we cover everything related to pregnancy and delivery, for example.
Those days are over.
For some of us, perhaps. But for many people, that is the main reason that they need health insurance. And we have health education programs. We have a program that's called Motherhood Matters, so it provides education and support to women during their pregnancy. And we also have a 24-hour nurse advice line, so people can call that number anytime, day or night, to talk to a nurse about what symptoms they have, who can advise them whether they should go to the emergency room or if it's something that they can manage themselves or go to their doctor's office the next day.
What does that program cost? I mean, just an average. Can you give an average of what that might be?
Well, it really, I can't, because there's different plans that have different costs.
Okay.
So I would just encourage people who are interested to, call our toll-free number, visit our website, molinahealthcare.com.
Get on the marketplace and see what's there for you. Now, it used to be that you couldn't be covered if you had a pre-existing condition. That's one of the good things about Obamacare, right?
That's right.
That now, if you have a pre-existing condition, if you're pregnant and you don't have health insurance, you can actually go now and get it.
Yes, that's true.
Okay, well that's the one good thing. The rest of it's been so confusing for me.
Yeah.
But it's nice to know there's a place that has plans specifically for these people that fall into that sector, and it seems to be a lot of people, isn't it?
Yes, absolutely. I mean, last year, or this year, 2014, was the first year of the marketplace, and so Molina has been participating this year next year will be our second year. And as I mentioned, we have plans in Dallas and Collin counties. And our costs are actually, the out-of-pocket cost for our members is actually less this year than it was last year. And it comes with a lot of great benefits.
Well, fantastic. Thank you so much for sharing with us. I know a lot of people are getting online right now to check it out. I'll be one of them as soon as this is over. There are still so many questions that you may have, but definitely go to the website there, and I think you'll find them answered for you, or you can call their toll-free number, 877-936-1223, Molina Healthcare. And thank you so much again for being here.
It's my pleasure.
We have more broadcast right after this. Don't go anywhere.